Dr. Bruce Matthews, one of our local dreaded dentist types, is here to drill an important message into us tonight. February is, after all, National Dental Health Month, and we should all be encouraged to take care of our teeth before they take care of us. Welcome, Bruce.
Oh, thanks, Bob. It's nice to be here.
Now, I know you brought along some of the posters that I'm holding from this competition. Could you tell the viewers about the competition?
Most years the Dental Society tries to run a poster contest, among other things, and you can see that there's a fair amount of talent. A lot of the different grade levels and schools throughout the state were all asked to participate. Basically, flyers were sent to the art teachers, trying to get all or as many students as we could involved. I think that dentists and the dental community on the whole is trying to get away from the idea of the trip to the dentist being a dreaded chore that people have to accomplish. And I think the way to do that is by trying to help to educate people, making them aware of dental disease and of dental care. So we try to sponsor contests, poster contests, slogan contests, displays in malls, and things like that, so people will become more aware of their dental health.
Now, these posters, these are some of the winning posters or just a representation?
This is a cross-section of some of the posters. They are not all the winning posters. You can imagine there was quite a fair amount of talented people that had gotten involved in sending posters in, and that's just a random sampling.
Now, what are some of the essentials of tooth care?
Basically, we have to start off with toothbrushing. Obviously, you just can't get away from that. It's been like that for years. I think that unless people have been instructed otherwise, the best thing to use is really a soft brush, because a soft brush will flex around the teeth a little bit more than some of the others.
This is quite a large brush. Actually, I should get one like this, because I'm always losing mine, and I think I could really hold on to this one here.
Bob, you're really better off with a smaller brush than that.
Really?
One that you can get in and to clean the surfaces of the teeth a little bit more thoroughly. If you'd like, I'll be glad to show you the ideal way to brush your teeth. And I can't stress too much, unless you've been told otherwise, because of course there's different situations or conditions, usually because of the periodontal health of the teeth, that the dentist might have you brush in a different way. But basically, if you use a soft brush and get the bristles of the brush in the sulcus area, or in that point where the teeth are just emerging out from the gum, and to rotate the gum, or rotate the toothbrush rather, using small circular movements to loosen the plaque from around the teeth, and then of course move down this way, and of course it would be the opposite on the bottom. You'd want to get into the sulcus area and of course brush up. I think toothbrushing is certainly the most important aspect of tooth care, although we really can't minimize dental floss. Toothbrushing, for the most part, will cleanse the outer surfaces of the teeth as well as the biting area, but to get down in between the teeth, in the areas where toothbrushes just won't reach, we certainly need the floss. And to floss properly, we of course would wrap the floss around their middle fingers, and to go in between the sulcus of the teeth, and to go up and down 5, 6, 7 times on the surface of each tooth. That's something that you want to be fairly careful about doing. You want to be judicious in terms of getting all of the plaque out of the teeth, but on the other hand, you don't want to damage the gums.
Now, what are the types of foods that we ought to avoid?
Basically, the main emphasis is in staying away from sweets. The whole decay process is one where the bacteria that's normally present in your mouth, the bacteria ferments incoming sugars that you get from different varying food sources, and produces a very mild acid. The acid then in turn etches or wears away or decalcifies the enamel surface of the tooth, allowing more bacteria to penetrate inside the tooth, and therefore to cause the decay.
And obviously we have to visit the dentist too to take care of our teeth.
Well, of course, everyone needs routine care for no other reason than to remove the tartar and the calculus and deposits that form, as well as check on the cavities that, although we don't like to admit, sometimes do occur.
Well, thank you very much, Bruce, for coming on.